guys, today we have last class of pathology critical sorry guys, today we have last critical class of pathology. So in this chapters we will study about the pathologic types of primary glomerulonephritis. Number 1, minimal changes disease, lipoid necrosis, membrane glomerulonephritis. And so guys, follicle segmental glomerulosclerosis and membranoproliferative GN, acute post-infectious GN, IgA nephropathy, crescentic GN, chronic GN. So we got two slides from Dr. Wesley. This is the slides. We are going to put that inside the microscope and we'll show you another slides too. So guys, we are in China. We're studying MBBS in China, so I'm just showing some how it is studying during this lockdowns. And I think most of the migrations are closed for international students, but we are still taking classes inside universities in China. So these are the slides. Now I'm gonna ask about the slides from the leader of the class. What is the slide about? And then we'll show you, and then we'll proceed with our work of the slides. So guys, the class takes little time because students are coming. This is our microscope and we'll put slide here in this place, and this suggests we'll study about the disease of urinary systems. And first we'll discuss about the acute post-infectious glomerulonephritis disease, GM, and second the chronic glomerulonephritis, chronic GM. And first then we'll discuss the acute glomerulonephritis. In second ones we'll discuss the glomerulonephritis chronic ones. Stay with us and learn. All those doctors are seated there outside and teacher is describing on a board.
It has another lemma, lipoid necrosis. And the second one is membranous GN. And the third one is
And so we'll review and the review of normal kidney structure. And these are the cortex, these are the medulla stebuji, oh sorry, medulla. These are the capsule, this is the ureter, tract, okay, 5. This is the renal calyx and this is the renal pelvis, okay.
Yes, it's a kidney.
This is the kidney and the structures. Inside the medulla and the cortex, there is the nephron tubules, or you can call it conductive tubules too. So it just shows, and this is the basic structures of, and this is the,
It's a HE stain. Do you know an HE
this is the
stain?
cortex and medulla, and we're talking about cortex and medulla. So this is the cortex, that dark area of the kidney, and this is the medulla, light area of the kidney.
And here is the medulla.
These are the
The cortex.
glomerulus,
Here
see,
you can see
and this is the nephron, is the functional unit of kidney. Most glomerulus,
what's this? It's glomeruli.
glomeruli, ah sorry, glomeruli,
It's glomeruli.
glomeruli, we can call it glomerulus too. So
One glomerulus, we call it glomerular. Many glomerulus, we call it
nephron, the function unit of the kidney, and nephrons, a glomeruli.
it's
Here is the glomeruli, and
here you also can see some.
so
You also can see some.
the nephron functional unit of the kidney, glomeruli, and renal tubule, proximal tubule, distal tubules.
And the glomerular and the renal tubule.
See, medulla consists of
And here
collecting
here
tubules.
is medulla. Medulla consists of collecting tubules. Here is the renal tubule, and here is the collecting tubules. Do you know what's the functional units of the kidney? Nephron, right? Yes, nephron.
Do you know what is the
Is the
functional unit of
functional
nephron?
units of the
It's the
kidney.
smallest unit in the kidneys,
So where the nephron is located,
where the
most of the nephrons are
filtrations take
cortex.
place in it.
Most of the nephrons are located in the cortex.
Most of the
Okay, you can
nephrons are
see
located in the
nephron
cortex.
in the cortex.
See,
And here is the medulla. Medulla always consists of collecting tubules. And here
and here,
we also
in segment, I will show you. This is nephron.
review.
This is the
Nephron is the functional
glomeruli.
units of the
Okay,
kidney.
this is
They
proximal
are
tubes
composed
near
of
to body and
glomeruli
distal away
and
from the
renal
body, away from the
tubules.
glomerular tubule distal
Renal
tubes, and this is the
tubules
thin
is
segments.
composed of
And lastly, this is the
proximal
collecting duct,
tubule, distal tubule, and a thin segment. Here in this picture, here, what's this?
glomeruli.
Glomeruli, right? Yes. And here, what's this?
This is a proximal
This
tube.
is the proximal tubule. And the pink one, what's this? It's
This is the
distal tubule.
distal tubule.
And between the red and the pink one is the
This is
yellow. These are
this is proximal tubule. This is a thin tubule. This is distal tubule, and this is a
nephron is
collecting
composed
duct.
of glomeruli, proximal tubule, thin segment, and the distal tubule. They are
So today we'll study
post-SGN
two
what
types
we
of
call it, acute SGN,
glomerulonephritis, acute and chronic.
post-SGN, acute diffuse proliferative
What is the
GN,
difference between the acute
and
and chronics?
pulmonary proliferative
Chronics are
GN.
those diseases which affect their
This
symptoms
is very important.
1 weeks
We just
and
remember
within
the
2 weeks, you know. And
eight
chronics
type
are
of
those
brain
diseases which do
inflammation
not
and
affect the
then
symptoms
acute
but
GN. Okay.
and they will
Remember this acute
show
GN, right?
their symptoms in the passage
Acute
of times, 6 months,
post-infectious
maybe
GN, we call
1 year. It
acute
seems like
GN.
suppose atherosclerosis disease of heart is anything
So
acute disease,
we
chronic
want to
disease. So
know what's the feature or what's the characteristic change of this kind of GN. What's the features? The feature is
the other terms of
endothelial
acute.
and mesangial cells proliferation. So now let's see the morphology. Rows.
As you're watching
You can see in
morphology
this
cross
picture, you can see the kidney is big.
enlarged with the
It's
congestions,
big.
with tiny red
It's enlarged.
speckles, phlebite,
Because of the
hemorrhage.
congestion, it's enlarged with congestion. It's big.
It means it means
And
that the
what's the
kidneys are
color of
damaged.
the kidney? Dark red. It's dark red, right?
Dark
Because
red.
of the congestion. So it's red.
The
It's
kidney is
dark
affected
red.
because of congestion.
And in the surface of the
It
kidney,
seems like if we have studied that the liver cirrhosis disease,
and
it was infected by
you also can see the
showing you the upper
tiny
surface
red
nodules.
speckles
So
here.
same as
You can
here,
see the dark
the kidneys,
spot,
the red speckles.
in the
See
surface
on the
of the
surface of the
kidney.
kidneys,
These tiny red speckles.
tiny red speckles.
Why?